Hi and hello dreamers. This is your Dr. Bharat Kumar VD, Pharmacology faculty, PrepLadder. Just tell me the audio video is fine, then we can. This is your Dr. Bharat Kumar VD. Okay. So in this session, we are planning to discuss the FMG Jan 24 Pharmacology recall questions. So before I begin this, the disclaimer is the questions discussed in this PPT are called are mainly recall based questions, and the motive of this live session is to get the actual question asked in the exam. So once we receive the final questions, the final questions will be uploaded in the PrepLadder app for your future references. Okay, so just tell me whether the audio idea is fine, then we can move forward. Just put a message. Malchik, just put a message. Audio video is fine. Okay. Yes. So before I move on to discuss the questions asked, now what about the topics that were asked in the FMG exam? Were they commonly asked topics? Were they newer topics? Let us analyze here. Now the topics what we got in FMG exam currently is the drugs in pregnancy, which is a stock question. Drugs used in malaria. Every year the treatment of malaria is asked, either the complicated malaria, prophylaxis of malaria. This time the treatment of malaria in pregnancy was asked. Now TB drugs, what are the TB drugs and the adverse effect of TB drugs is a stock question in every exams. Then arrhythmia and its drug of choice. One of the famous drug, Amiodarone, the class 3 antiarrhythmic, its adverse effect is repeatedly asked. Then the disease Myasthenia gravis, how do you diagnose and treatment? Then the management of hypertension in pregnancy. All these are the repeated topics only. Now moving on to the other aspect, they had asked drug contraindications. And one more stock question was antipsychotics. So when we give antipsychotic, particular typical antipsychotics, there is a risk of extrapyramidal symptom. How do you manage that is asked. Mountain sickness, the drug of choice, alcohol and the disulfiram-like reaction. Then helminths and the drug of choice and the drug interactions. Along with that, the diuretic mechanism of action, the contraception, and please remember the antidote. Every exam, one MCQ will be regarding antidote. So antidote list we have discussed plenty of time in RR and LRR. The drugs for glaucoma, the pharmacokinetics, the mechanism of action of antidiabetic drug, anticoagulation pregnancy. Was there any question on new drugs? Pharmacology, no new drugs currently being asked, I think so. So this is the analysis of paper from pharmacological perspective. No new topic, the topics are same, the questions are the same, so they are tested. So no new concept has been tested this time. Now moving on to the next question, drugs absolutely contraindicated in pregnancy. So we have discussed teratogenic drugs plenty of times in LRR, rapid revision and most of the YouTube sessions. So what is a drug contraindicated in pregnant women is the PrEL. So any drug ending with PrEL is an AC inhibitor. AC inhibitors or ARBs. So ARBs ends with sartan. These are absolutely not given in pregnancy because they cause renal agenesis. So captopril is the answer for this. Paracetamol is one of the safest analgesic in pregnant women. Ranitidine is a H2 blocker. It's used in peptic ulcer disease in pregnancy. It's also safe. Cefixime is a cephalosporin. So antibiotic safe in pregnancy, we have a mnemonic PCM. So P for penicillin, cephalosporin, macrolides such as azithromycin, erythromycin, these are safe in pregnancy. This concept is repeatedly asked. So captopril is absolutely contraindicated in pregnancy. So this was not there, no problem. Let us do the learning. So it will benefit you, it will benefit the one who watches the video later also. So any other questions you want to put up, please post it in the comment section. Okay. Now again the question is, what is the treatment of choice in a 2-month pregnant female diagnosed with falciform malaria? So the students were in a confusion whether it was falciform malaria, and that's why we have framed one more question. What's the drug of choice for Vivax in pregnant women? Now, before we come to the answer, it's better we discuss the treatment of malaria in pregnancy. So, pregnant women having malaria. So, basically, two infections very common. One is the vivax and one is the falciparum malaria. So, Plasmodium vivax and Plasmodium falciparum. Now, in India, the vivax is still sensitive to chloroquine, and chloroquine is safe in pregnancy, so we can give chloroquine to the pregnant woman. That is safest. Now, vivax means we should do radical cure, but the drug which is used for radical cure is primaquine. The drug which is given for radical cure is primaquine, but primaquine is absolutely contraindicated during pregnancy. Then what should we do? If you want to give primaquine, you have to give primaquine after the delivery of the baby. Sir, what happens if they get relapse again? If they get fever again, we continue chloroquine. So primaquine should not be used in pregnancy. It is given after delivery. Sorry. Coming to falciparum. Falciparum in India has become resistant to the chloroquine. So we use combination therapy. The regimen is called ACT regimen. But ACT regimen we don't prefer in first trimester. So first trimester of pregnancy, the regimen that is preferred is a combination of quinine plus clindamycin. So quinine plus clindamycin is preferred in first trimester. They are safe. Suppose the lady is in second and third trimester, and then we can use artemisinin based combination therapy in second and third trimester. So this is the regimen. Okay, so these are the vivax treatment and this is the falciparum treatment we have understood. Now coming to the pregnant who has got complicated malaria or cerebral malaria, then what is the treatment for complicated malaria in pregnancy? It is nothing but IV artesunate. So we can give IV artesunate. So this is how we manage the malaria cases in pregnant women. So vivax, chloroquine, and falciparum first trimester, quinine plus clindamycin. So if I go back to the question, they are given falciparum 2 months, that is first trimester, the best drug will be quinine. So where is clindamycin? Many times if clindamycin is not available, a single drug quinine is given. So ACT is not given, doxycycline is not given. IV artesunate is given only if the malaria is complicated or cerebral malaria. So here the best answer will be quinine. Now if the question was vivax, then the answer would have been chloroquine. That is the drug of choice in first trimester in pregnancy. Okay, yes. Now let us move on to the next one, treatment of ventricular tachycardia. So I told you, they keep on asking arrhythmias again and again, like atrial fibrillation, flutter, SVT, PSVT, tachycardia, fibrillation. So tachycardia is one of the stock questions they have asked. And the drug of choice for that is amiodarone. So one of the famous drug, amiodarone, is used for this. Okay, just a minute. Okay, so welcome back. So the drug of choice for ventricular tachycardia is amiodarone. Sir, when we give lignocaine, lignocaine is given if the ventricular tachycardia, so digoxin-induced ventricular tachycardia, then the drug of choice becomes lignocaine. Sir, can't we give amiodarone for digoxin-induced ventricular tachycardia? No, because amiodarone can increase the levels of digoxin and that will lead to toxicity. Again, the arrhythmias worsen. So ventricular tachycardia, the best drug will be amiodarone. That is the best drug. Clear? Yes. Now moving on to the next question, least associated side effect of amiodarone. I have told plenty of times, amiodarone is a commonly asked drug for adverse effect. Will it cause hypothyroidism? Yes. Will it cause hyperthyroidism? Yes. So that's why we call this as thyroid dysfunction. So amiodarone can produce thyroid dysfunction. That means it can produce both hypo and hyperthyroidism. Yes, it can produce lung fibrosis and very rarely it will produce gynecomastia. Very, very rare. Some reports have been seen with amiodarone. Otherwise, these are common. Thyroid problem, pulmonary fibrosis. So the answer will be gynecomastia. So the drugs causing gynecomastia, you know, mnemonic disco drugs, digoxin, isoniazid, spironolactone, cimetidine, estrogen. These are commonly known to be associated with gynecomastia. Okay. Okay. So any other queries? Let me check. Okay. Then moving on to the adverse effect of amiodarone, let us understand the mnemonic for that is please check LFT, PFT, TFT and allergy. P, peripheral neuropathy, photosensitivity that will cause blue man syndrome. And these are the adverse effects of amiodarone. Check corneal deposits, we call it as cornea verticillata or vertex keratopathy. It can cause liver dysfunction, lung fibrosis, thyroid dysfunction, that is both hypo and hyperthyroidism, and it can produce allergy and rash. So these are the adverse effect what is seen with the drug amiodarone. Amiodarone can produce these adverse effect. Okay, yes, so please note down these things. Now moving on to the next question, myasthenia gravis. I told you one of the common problem which is asked in the exam. Patient had ptosis and worsening by evening, and he was diagnosed with myasthenia gravis. I don't know whether they had given the diagnosis. Some student tell that there was a ptosis which was worsening in the evening, and what is the drug of choice for that? So the problem in myasthenia gravis is there is autoimmune antibodies. The antibodies are targeted towards nicotinic receptors, that is at the neuromuscular junctions. So there will be muscle weakness. So the best treatment for that is anticholinesterases. Now what do? They increase the acetylcholine action, and this acetylcholine can bind to NM receptor and they increase the muscle contraction. So they increase or improve the muscle contraction. Now what is the anticholinesterase that is used? In the option it is pyridostigmine. What is another anticholinesterase which is also used for myasthenia gravis? That is called neostigmine. 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 Now don't confuse this with a drug called physostigmine. Physostigmine crosses blood-brain barrier. We don't want the drug to work in the brain. So the drugs preferred in myasthenia gravis, neostigmine and pyridostigmine. Sir, what about steroids? Now steroids are used if the patient is not responding to anticholinesterase. Sir, what about cyclosporine? Cyclosporine is an immunosuppressant. We use it in the advanced cases. If they are not controlled, then only we use this. Plasma exchange or plasmapheresis, they are used in emergency called myasthenic crisis. So that's why the drug of choice for myasthenia gravis patient is neostigmine or pyridostigmine. Sir, what is the drug used to diagnose myasthenia gravis? If you ask me, the name is edrophonium and the test name is called tensilon test. Again, it is a repeated question in exams. Now moving on to the next one. Pregnant mother who is known case of asthma is having BP of 160 by 102. Drug of choice in this condition. See, whenever they give the question pregnant mother and asthma, so they are testing whether you know which drugs are contraindicating asthma. Now, usually we know that hypertension in pregnancy, the drug of choice is labetalol. We know that. But labetalol is non-selective, so it will block alpha and beta. So which beta? It can block both beta 1 and beta 2. Now what happens if it blocks beta 2? Beta 2 is present in the bronchus, so it will lead to bronchoconstriction and it will worsen the asthma. So the labetalol is ruled out. Thiazides are not preferred in pregnancy because they decrease uteroplacental circulation. So what do? They decrease the circulation in uteroplacenta. They decrease the uteroplacental circulation. Again, propranolol is a non-selective beta blocker. So what is remaining is nifedipine. Now nifedipine is a CCB, safe in pregnant women, and it's a CCB. It can not cause bronchoconstriction. So the choice will be nifedipine. Nifedipine is the answer, and we have discussed this plenty of times. Drug safe in pregnancy. The mnemonic is let me do care. Hypertensive pregnancy. Labetalol is the drug of choice. Earlier it was methyl dopa. If it is not there, you can give nifedipine sustained release. The other options are clonidine, hydrolysine, prozosine. So this is the table. And teratogenic drugs, antihypertensive which are teratogenic mainly are the ACE inhibitor, they are prils, the ARBs, there are sartans, because they cause renal agenesis. Yes. Yes, Asisi, hi. Ankit Sharma, hi. Sunil Pal, hi everyone. Okay, so how was the exam? Just put a message to me. So pharma, how was pharma? Questions? How was the pharma questions? So just check whether it is buffering, guys. I think it's running smooth from here. Just check the message. Okay. Vaishnav, even they have given IV or oral labetalol, we don't give it in a patient who has asthma because labetalol can also block beta 2 and worsen asthma. So the best option will be nifedipine that can be given. Okay. Now moving on to the next question. Again, the sickness. I told you motion sickness, morning sickness, the mountain sickness, all sickness are asked in your exams. A group of people are traveling to mountains and a girl starts complaining of mountain sickness. What is the drug of choice? If they are given mountain sickness, obviously the drug of choice will be acetazolamide. If they had given motion sickness, then you could have answered promethazine or dimenhydrinate because they are antihistamines having anticholinergic property. So what is the advantage of anticholinergic property? They can suppress the vestibular apparatus and decrease the motion sickness. And thiazide diuretics have nothing to do with any sickness, motion, morning, or the mountain sickness. So the answer will be B. The answer will be B. Then moving on to the next question. A patient after consuming alcohol started experiencing vomiting, abdominal pain, chest pain on examination. The patient was hypotensive. What is the drug causing these symptoms? So an alcoholic taking a drug and developing the chest pain, vomiting, it looks like disulfiram-like reaction. Now I have given the mnemonic. The mnemonic is great CPM. Sir, what is G for? Great. G stands for glycopulvin, which is an antifungal drug. C stands for chlorpropamide, which is a sulfonylurea used in diabetes. And also C stands for the cephalosporins. I told you there are 3 cephalosporins which are known to produce the disulfiram-like reaction. The name is cefotitan. Then we have cefomandole and cefoperazone. So if a man becomes tight, he will go to operazone. We have discussed this plenty of times. So the answer will be cefoperazone. Propranolol, CCBs, pantoprazole are not going to do that. P stands for the drug procarbazine and M stands for metronidazole. So metronidazole is a drug which is used in the management of amoebiasis. It is used in the management of amoebiasis. Okay, Robin, was there any change in the option? Okay, so if you find options, tell me. Even we are discussing here, if your options are different, even they would have given M for metronidazole in the option also, because we give metronidazole for treating amoebiasis and patient drinks alcohol and comes with these symptoms. Okay. Okay, so the condition was asked. So patient was given a drug for amoebiasis, then he developed this. What is the condition? Maybe disulfiram-like reaction. So if you have understood the concept, you have written the answer, then you are right. So don't worry about that. Okay, so understand the concept. The drugs, if person takes with alcohol, which can cause this problem is called disulfiram reaction. G for glycopulvin, C for chlorpropamide and cephalosporin. In that, we have cefamandole, cefotitan, cefoperazone, P for an anti-cancer drug, procarbazine, and M for metronidazole. Yes, Samriti, I told you that. Drug of choice for rheumatic fever. Rheumatic fever, we use antipyretic drug. And amiodarone is not used, it's an antiarrhythmic drug. Digoxin is not used, it's a drug used in CHF and atrial fibrillation. So the drug of choice is aspirin because it is an anti-inflammatory drug, analgesic and antipyretic drug, so aspirin is used. So furosemide has no role in rheumatic fever, so the drug of choice is aspirin, aspirin, aspirin. I think it's an easier one. Most of you would have answered because they have given fever. So you give antipyretic drug, aspirin. I think, okay. Now, what is the treatment of Echinococcus granulosus? So it's a dog tapeworm which will cause hydatid cyst. So it's again a repeated question. So the drug of choice for hydatid cyst or Echinococcus granulosus is albendazole. Can we use mebendazole also? Yes, but the efficacy is good with albendazole, so we can use this. Albendazole can be used. Okay, if it is not asked, then we'll move forward. I think this question was asked, what is the mechanism of action of thiazides? Diuretics, mechanism of action, they will be asking you. Sodium chloride import inhibition in DCT. Yes, this is the right answer. Sodium chloride import activation, they don't activate this, wrong option. Sodium potassium 2 chloride cotransporter inhibition in thick acyl loop of inlay, that is done by loop diuretics. And osmosis done by osmotic diuretic like mannitol, glycerol, urea, like that. So the answer will be A. Yes, this was asked, right? Yeah, this was asked. Moving on to the next question, I think this has been discussed in OBG also. Female had unprotected sexual intercourse. Now more than 5 days have passed. She fears getting pregnant. What is the contraception of choice? See, most of the drugs, they should be used within 72 hours. You take levonorgestrel, OCPs, right? They should be taken within 72 hours. There is a drug called ulipristal which can be taken up to 5 days. But here it is more than 5 days. So the drugs are not going to work. So what is the option we have is intrauterine contraceptive device. That is IUD will go into work. Simple answer. The next question is, patient was given 0.5% bupivacaine for brachial plexus block. After some time, the patient developed hypertension, arrhythmia. So when we give local anesthesia, patient developing low blood pressure, arrhythmia, seizures, that we suspect the local anesthetic toxicity. And we know that bupivacaine is one of a cardiotoxic drug when we use particularly for intravenous regional anesthesia. Now, I told you every time antidotes is a must for exams. We discussed in RR also, LRR also. Lignocaine, I have given the question. Antidote, what is the antidote? It is 20% intralipid. That is the best answer you can give us. So 20% intralipid should be given. That is the antidote for bupivacaine or any local anesthetic toxicity. It's a repeated question in your exam. Right? Okay. Then moving on to the next question. What is the drug of choice for malignant glaucoma? I think it has been discussed in ophthalmology also. Now, malignant glaucoma is a condition which happens after surgery. After surgery, the eye surgeries, it will happen. So here the pressure may be high also, it may be normal also. But here what we do is we have to use the mydriatic cycloplegics. So malignant glaucoma, we use something called mydriatic cycloplegics. So these are preferred in this patient. So the mydriatic cycloplegic drug in the option is homatropine. You know, mydriatic drugs like atropine, homatropine, cyclopentanone, tropicamide. Without cycloplegic action, mydriatic is phenylephrine. So these are preferred. Miotic should never be used. They will worsen this. Now remember, malignant glaucoma doesn't mean that it's a malignancy. It is a serious condition. Ofloxacin, not preferred. You can also use steroid, but they have asked the drug of choice. So the drug of choice is a mydriatic should be given. So even PGenologue is in the option, that is not the drug of choice. So immediately you have to use the mydriatic and relax the lens. Then you have to give a drug to decrease IOP like acetazolamide, beta blockers, alpha 2 agonist. and also some osmotic agents like mannitol can also be used in this glaucoma. Then anti-inflammatory drugs like steroids are also used, but the first therapy will be mydriatic. Cycloplegics are preferred in malignant glaucoma. Okay, so whatever the languages, we are learning the concept. Again, when you go to ophthalmology revision, you have to learn these things. Which is the preferred antipsychotic in obese patient? They have discussed in psychiatry. You know that most of the antipsychotics, they can cause weight gain. In that, the least weight gain is done by a drug called ziprasidone. So the answer is ziprasidone. Ziprasidone. Ziprasidone will not cause so much of weight gain, and olanzapine, clozapine are going to cause maximum weight gain in antipsychotic, that is atypical antipsychotics. Okay, so moving on to the next one. Which of the following antidiabetic drug causes glucosuria? That means loss of glucose in the urine. Was this question asked? Please confirm. Please confirm this. Yes. So which is the antidiabetic drug which causes loss of glucose in the urine? They are SGLT2 inhibitors. Now, what is the role of SGLT2? To reabsorb glucose in PCT. Now, when you stop that, the glucose goes out in the urine. That is called glucosuria, and that is done by gliflozin. So read the name. Gli means glucose, flow means flow. So they increase the glucose flow in the urine. That's why the name gliflozin. So the name is empagliflozin. Glimepiride is a sulfonylurea. It inhibits ATP sensitive potassium channel and increases insulin release. Exenatide is a GLP-1 agonist, and acarbose is a alpha glucosidase inhibitor. So all these drugs are used in diabetes, but the drug which increases the glucose urea is gliflozin. So what is the disadvantage of glucosuria? There is a risk of UTI and genital mycotic infection. What is the advantage? It will have a diuretic effect, and that's why they can also decrease mortality in CHF patients. That's the advantage. Now moving on to the next one. I don't think this question was there or not. We have framed it. You tell me. A 6-year-old child with history of generalized tonic-clonic seizure came with convulsions. What will be the appropriate management for this? What will be the appropriate? So if the patient is convulsing, first thing what you have to do is control the convulsion. So what we do is we have to give lorazepam. First stabilize the patient. Once the patient is stabilized, then you can give levetiracetam, and the patient can take it for a long time. So valproate followed by gabapentin, no, because gabapentin is not going to work for long, and it's not so much effective drug for GTCS. Carbamazepine followed by gabapentin, no. Levetiracetam followed by gabapentin, that is also wrong. So the only option what I got from the options is this one. Magesh, pharma good volume of questions have appeared. Tell me whether it was one-liner or whether it was case-based, whatever, but repeated concepts, repeated topics have come in pharma. So that's what my message to you. Okay, right. Now again this question, you have to correct me. 62-year patient with hypertension is on hydrochlorothiazide or thiazide diuretic. He developed fatigue and hypokalemia. Which of the following drug can prevent a potassium loss? You know that when we use diuretics like thiazide or loop diuretic, they lose potassium. So when they lose potassium, patient will develop hypokalemia and fatigue, muscle weakness, and all those things. Now, what is the drug which can preserve potassium, or just tell me which is a drug which is a potassium sparing diuretic? Furosemide is a loop diuretic. It will lose potassium. Amiloride is a potassium sparing diuretic. So this will be the answer. Acetazolamide, yes, it will also lose potassium. Adenosine is a drug of choice for PSVT. So these are not the options. The correct answer will be amiloride. Potassium sparing diuretics, the mnemonic is paste. So what is paste? P for potassium sparing. A, amiloride. S, spironolactone. T, triamterene. E, eplerenone. Let me repeat again. A, amiloride. S, spironolactone. T, triamterene. E, eplerenone. Okay, one-liner, clinical and lengthy, so it's okay. It should not be fully clinical, it should not be fully lengthy. So it is a mixture of question, that's good only. Yeah. So was this question asked? Tell me yes or no, guys. So the thiazide was given, there was hypokalemia. Then what is the drug which can prevent the loss of potassium? Was this asked? Just tell me. Okay, just tell me. Yes. Was this question asked? First trimester pregnant has DVT and she needs anticoagulation, which is the preferred anticoagulant in pregnant women. Is it enoxaparin, clopidogrel, betrixaban, warfarin? For what beta blocker is the answer? Yes, so a pregnant female, again I told you pregnancy and drugs, they keep on asking you in the exam. So in the first trimester, we don't give warfarin, so we use low molecular weight heparin, and the low molecular weight heparin, they end with parin, so enoxaparin is the best option. Clopidogrel is an antiplatelet, it's not going to work in DVT. Betrixaban is a 10A ban, it's a direct 10 inhibitor which is given oral. Warfarin is absolutely not given in pregnant women, particularly in first trimester, because it can cause fetal warfarin syndrome. That's why. Then what was there in the option music? Sekhar, tell me for what question you are telling propranolol is in the option, because there is a mismatch in the communication. Okay, so here enoxaparin is the answer for this. So first trimester preferred anticoagulant is heparin, that is unfractionated heparin or low molecular weight heparin. Why, sir? Because they don't cross the placenta and don't affect the fetus. Now coming to the next question. A patient was given antipsychotic drug haloperidol. Patient developed acute dystonia, which is the next best step. Again, it's an extrapyramidal symptom. When we give haloperidol or any antipsychotic, that is typical antipsychotic, to young patients, what happens? The dopamine level comes down, acetylcholine goes up, the neck muscles will become dystonic, the eyeballs will uproll, that is called oculogyric crisis. Now what do you do immediately? You have to give anticholinergic drug, and that is called benztropine. Usually every time they used to give benzexol or promethazine in the option. So this time for a change they have given benztropine. Remember benzatropine. Atropine is an anticholinergic drug that can be given. Change to clozapine, that is the next. After you treat this problem, then you can go for clozapine, because clozapine will produce least extrapyramidal symptom. Give fluphenazine, increase the dose of haloperidol, they are going to worsen this problem. So the best one is give benztropine. I told you repeatedly in LRR, RR also, antipsychotic and extrapyramidal symptom is a must know topic. Okay. Yeah, Magesh, torticollis was given in the option. Very good. Torticollis. That is a repeated question. Last year also they had asked this question. Okay, sir. Now, was there a question on bioavailability, tamoxifen, anti-TB drug adverse effect? Just tell me. Was there any question on bioavailability? Was there any question on tamoxifen? Did they ask a drug used in breast cancer, tamoxifen? Did they ask in anti-TB drugs, drug causing ocular side effects like ethambutol? I told you, ethambutol, remember for eye, ethambutol for eye adverse effect. It can cause optic neuritis, red-green blindness. And also, did they ask you bedaquiline? Bedaquiline, last time they asked the mechanism of action. This time did they ask you the EC changes, that is QT prolongation? Just tell me. You're all telling yes, but what was the question? Tell me. Yes. Okay, so tamoxifen is a SERM. Remember, it is a SERM which is used to manage breast cancer, both in pre and postmenopausal women. But the problem with tamoxifen is it can increase the risk of endometrial cancer. That is one concept. Okay, bioavailability they are given 30% bioavailability means. What do you mean by 30% bioavailability? The meaning is, if I give 100 milligram of drug to a person orally, how much you will get viability is 30 milligram. That means 30% reaches systemic circulation. So the meaning is 30% reaches systemic circulation. That is the meaning of bioavailability. Yes, Amriti, you're right. That is the meaning. If they are given 30% viability, that means 30% will reach the systemic circulation. We have discussed IV has 100% viability, means all the 100% of the drug will reach the systemic circulation. That is the meaning of it. Yes, option was confusing. It's okay. Right. So these are the questions from pharma. What I have got, guys. Again, viability, stock question, tamoxifen, TB drug. Let me go back. Is this a stock question? I told you repeatedly. Typical antipsychotics, acute dystonia, extrapyramidal symptom is a must-know topic. Pregnant, which is the anticoagulant of choice, heparin group. Then diuretics, which diuretics cause hypokalemia, which drug cause hyperkalemia, that is potassium sparing diuretics, we have discussed. Then the drug of choice for GDCS. Yes, Badaquilin, they had asked EC changes. That's what I told you. QT prolongation, it is caused, and mechanism of anti-diabetic drugs and antipsychotic preferred in obese patient. Malignant glaucoma, yes, maybe it's a googly. If you have not read, you wouldn't have answered it. Then antidote, I told you, local anesthetic toxicity, intralipid is the antidote. Then contraception, you would have studied in OBG, you have studied in pharma also. Then thiazide mechanism, diuretics mechanism, we are told repeatedly, never make a mistake. Helminth, we have prepared a chart and we have wrote what are the drug of choice for different helminthic infections. Then rheumatic fever, straightforward question, aspirin. Then disulfiram-like reaction, whatever the question may be, remember this great CPM mnemonic. So if these drugs are taken with alcohol, patient may develop vomiting, nausea, chest pain, all those things. That is disulfiram-like reaction. Then a group of people are traveling to mountains. I told you sickness, motion, mountain, morning sickness, stock question. They have asked this time mountain sickness, hypertension in pregnancy is safest, but this time they tricked you. Hypertension in pregnancy, every time they were giving, but now they give hypertension with asthma. So labetalol cannot be given because it's a non-selective beta blocker. We have discussed cardioselective non-selective beta blockers. Then myasthenia gravis stock question. So the first choice of drug for myasthenia gravis is anticholinesterase, that is neostigmine, prodostigmine. Patient is not responding, then we go for steroids. Still not responding, we go for immunosuppressant. If there is a crisis, emergency, then we go for plasmapheresis. Then amiodarone, a stock drug. Never miss amiodarone. I told you plenty of time. The adverse effect they are asked. Then the ventricular tachycardia, the arrhythmias and drug of choice are asked. Again, malaria. So every year, malaria is a favorite for examiner. Last time they had asked cerebral malaria. Earlier they had asked prophylaxis of malaria. This time they asked malaria in pregnancy. Right. And teratogenic drugs contracting pregnancy. So these are the topics. I have made a list. What was the topic asked? Now, if you analyze the paper, was the topic new? Just message me. Was the topic new? Lactulose composition, that's a biochemistry question. I think they would have discussed with you guys. Shekhar Joshi, if estrogen was there, obviously estrogen cannot be given in breast cancer because it will increase breast cancer. So tamoxifen will be the answer. Easy changes in bedaquiline, QT prolongation, very good. Ethambutol optic neuritis, very good. You would have written that. Lactulose, I think it's a biochemistry question, not a pharma question. For malaria, chloroquine plus primaquine. See, pregnant women, chloroquine plus primaquine we don't give. What we do is we give chloroquine. Why we cannot give primaquine? Because it can cause hemolysis. Where, sir? In the fetus. Why, sir? Fetus are relatively G6P deficient. So what we do, we give chloroquine. Sir, what if she gets again malaria? We give chloroquine again. Once she delivers the baby, then we can give radical cure with primaquine. That's why that option cannot be taken. Quinine, see, if it is falciparum, then you can give quinine. Quinine is the preferred one in first trimester. If even quinine is given, that is the preferred one. So better option is quinine plus clindamycin. If it is not there, quinine can also be given. No problem. Okay, Vaishnav, what was the question about bisacodyl laxative was given immediately emptying of bowel? Okay, so 2-month pregnancy, obviously quinine is the answer. Chloroquine would have been answer if it is Vivax. Okay, any trimester Vivax, it is chloroquine. In falciparum, first trimester it is quinine. If that is not there in option, quinine plus clindamycin. Second and third trimester, ACT. Bisacodyl will empty the bowel, Vaishnav, but it will empty the bowel if you give it 1 hour. That means if you give upper rectally, 1 hour it takes to empty the bowel, bisacodyl. But if you give orally, bisacodyl will take 8 hours to empty the bowel. But if you give bisacodyl rectally if you give bisacodyl, within 1 hour it will empty the bowel. Doc North. Okay guys, so any other queries? All are confused with malaria? I think I have given the clarity. For example, it was just a PS. If it is stool softener, we go with bisacodyl, no problem. So lactulose is called as osmotic laxative. So if it is stool softener, then we can go with this. Okay. Remember, lactulose is a osmotic laxative. Okay guys, so I hope you have done your best for the exam and relax. So let us pray the God to give you the best result. Let everybody score more than 200. So let's be positive and we get the maximum result this time. So let's dream for that, and you've done your best. So don't worry about that. Relax for a few days and chill out. Viability question is nothing but if they are given 30% viability, what do you mean by that? It is nothing but 30% is available for systemic circulation. That's it. Okay, so any other query? So yeah, that's the meaning. If 30% viability means 30% is available for systemic circulation. That's the meaning of it. Okay guys, so any other queries you can put in the comment section, and I wish you all the very best for the results. I hope this session you found it useful. So any other queries you can put in the comment section. Take care, and I wish the God again for the beautiful results and hoping for your messages. So thank you all. Take care.